Good morning, one and all. It's me, Abilash, and here is Merin. The B-GHUD fraternity welcomes you all onto this online platform. Hope you all are safe and fine. എല്ലാവരും നന്നായിട്ടിരിക്കുന്നെന്ന് വിചാരിക്കുന്നു. അപ്പോൾ once again നമ്മൾ യൂട്യൂബിൻ്റെ ഈ ഓൺലൈൻ പ്ലാറ്റ്ഫോമിൽ കണ്ടുമുട്ടുകയാണ്. We'll be having an interesting session today. We are going to take an exam session topic. Exam session topic ആയിട്ട് നമ്മളിവിടെ വന്നിരിക്കുകയാണ്. Hope you'll enjoy this. And before that, B-GHUD fraternityയിൽ നിന്നും wish you all a happy Easter and very prosperous wish you. So, good morning, Merin.
Good morning, sir.
Ready, Anna?
Yes, sir.
So our students and all aspirants are waiting for this role play.
Yes.
അപ്പോൾ നമ്മൾ ഇന്ന് ഒരു റോൾ പ്ലേ ഡിസ്കഷൻ ആണ്, ഒരു എക്സാം ഓറിയൻറ്റഡ് ടോപ്പിക്കാണ് നമ്മൾ ഇന്ന് പ്രസൻറ്റ് ചെയ്യാൻ പോകുന്നത്. ഓക്കെ, സോ ഇറ്റ്സ് എ ഡേ ക്ലിനിക് ആൻഡ് ദ nurse Merin will be playing the role of nurse and I'll be the interlocutor. I'll be playing the role of patient. ഞാൻ പേഷ്യൻ്റെ റോളും മെറിൻ ഇവിടെ നഴ്സിൻ്റെ റോളും ഡെമോൺസ്ട്രേറ്റ് ചെയ്യുന്നതായിരിക്കും. So Merin, you are ready?
Yes, sir.
Here is your topic.
Thank you, sir.
And we'll be having a preparation time for 3 minutes.
Yes, sir.
Okay, all the best.
Thank you.
Merin, you are ready?
Yes, sir. So, how may I address you during this role play?
You could call me Martha.
Okay.
M-A-R-T-H-A.
Okay, thank you, Miss Martha.
Shall we start?
Yes, sir.
There will be 5 minutes for you to present this topic.
Okay. Good morning, Miss Martha.
Good morning.
My name is Merin. I am one of the registered nurses working in this day clinic. Okay, I hope you have finished your consultation with the doctor. Am I right?
Good morning, nurse. Pleasure meeting you. Yes, I have just finished my consultation with the doctor. He has asked me to come to you.
Could you please hand over your health report?
Yes, here it is.
Thank you. So, from the health report, I can see that your doctor has diagnosed your condition as post-traumatic epilepsy, and doctor has also prescribed you some medications in order to prevent further attacks. Am I right?
Correct, nurse.
Okay.
I'm really very anxious. I don't know what actually this epilepsy is. Even regarding the medications, I'm anxious. I'm scared totally, nurse.
Don't worry, Miss Martha. We are here to help you. We will definitely give you some measures in order to prevent your problems. Is that okay for you?
Okay, nurse.
So, Martha, in order to get a clear picture of your condition, shall I ask you a question?
Yes, please.
Okay. Tell me, Miss Martha, what all are the problems that you are experiencing since the road traffic accident?
Nurse, it's very tough, my situation is.
Okay.
I have had this recurrent blackouts and also headache. And even I feel tired and less alert.
Okay,
That's what.
Okay.
I really cannot concentrate on my work.
Okay, Miss Martha, I'm so sorry to hear that you are experiencing some kind of problems after that incident. But don't worry, you are in our safe hands and you are at the right place. Doctor has already prescribed you some medications, so you can continue these medications to manage your condition. Is that okay for you?
I'm worried at this prescription, nurse.
Okay, what all are the anxiety that you have?
Is this safe to continue? Is this safe to use?
Miss Martha, I do admit your concern and it is reasonable too, but you don't want to worry about the safety of these medications because these medications are clinically proven and scientifically tested. So if you take this medication, you can manage your condition without any doubt. So are you ready to take these medicines?
Okay, nurse. Then tell me how long will I need to continue these medications?
Okay, your concern is really valid, Miss Martha.
I'm totally worried, nurse. I'm upset.
Yes, I can understand your concern. In your case, you need to continue these medications at least for 4 years.
4 years.
Yes, for if there is no seizure at this time of at this course of medication, but you need to continue this medication as a lifelong course if you experience any kind of seizure at the time of taking this medication. Is that okay with you?
Once again, nurse, is this safe for a long-term use, nurse?
Miss Martha, I can understand your concern. As I have told you before, these medicines are really safe. You can continue this medication for a long term.
Okay.
Is that okay for you?
Okay, nurse.
Okay.
Thank you, nurse. So how about my future? Will I be able to lead a normal life?
Actually, I do admit your concern, Miss Martha. In your case, you have epilepsy. Am I right?
Yes.
Yes. So
I really don't know what actually it is. This
Yes.
headaches, blackouts.
Yes, Miss Martha, I can understand your situation. But Miss Martha, if you continue this medication, your headache and blackouts, your tiredness, you can manage those problems by taking these medications. And when I'm telling about epilepsy, actually epilepsy is nothing. It is an abnormal electrical activity of a brain. So if you want to manage your condition, so definitely you want to take this medication. See, Miss Martha, I have seen many people like you, those who have already taken this medication and they are leading a normal life right now. So you don't want to worry about this by taking this medication.
So I can trust your words.
Definitely you can trust my words, and I assure you that if you take these medications, you can manage your condition without any doubt.
Okay, nurse, thank you. I'm now a bit confident.
Yeah. Do you have any other concerns?
Nurse, yes, I've got a concern. See, how about my travel plans? Does this epilepsy and this medication have any implications over my travel lifestyle? See, I have to travel a lot for my business and my job activities.
Yes.
And even I have heard that there are certain restrictions for medicines.
Yes.
Some medicines are not fit for cross-border conveyance.
Yes.
How about that?
Your concern is really reasonable, Miss Martha. Actually, you can take these medications wherever you go.
Okay.
Okay, and just one thing that you want to do. Please keep a prescription card with you of these medicines.
Yes.
Okay, so you can travel anywhere with these medications.
Okay.
Your medication does not affect your traveling plans.
Okay. Thank
Is
you,
that
nurse.
okay for you?
Oh, yes, nurse.
So, are you willing to take this medicine?
Nurse, yes, I'll continue this. I need to go for a normal life. That's what. I
Okay.
should continue this, right?
Okay, thank you for your willingness, Miss Martha. And I would also like to provide you a literature about epilepsy.
You mean some booklets or information brochures?
Yes, that's
Please,
right.
get
Yes.
it to me.
Okay, that's right. And you will get a more idea. You will get more idea regarding this epilepsy, how to manage your condition very effectively. So, are you okay with it?
Please.
Yes. Moreover, there is a supporting services group in our clinic.
Okay.
So if you are interested, I can enroll your name in those programs.
Please put me in regular contact with them.
Yeah, okay. And I really appreciate your willingness for that. Miss Martha, I hope I have addressed all your concern. Is that right?
Yes, nurse. Yes, it was really worthy talking to you.
That's great to hear, Miss Martha. Do you have any more concerns?
No, nurse. Almost I'm clear. Thank you for this valuable information.
You want to come for a follow-up after 4 weeks. Doctor has already recommended you to come here. So please don't miss it.
Definitely I'll come for that, nurse.
Okay. Thank you for your patience in listening. Have a nice day, Miss Martha.
Well, thank you, nurse. It was really worthy talking to you. I'm very happy. Almost my concerns are resolved. In case of any queries, I'll definitely contact you. Thank you for this valuable time. Thank you.
Okay, Miss Martha. Thank you.
Merin, how was the session?
It was
Hope-
very nice, sir.
Hope you enjoyed.
Yes, sir.
So, how about you all? Hope you have all enjoyed this session. So, now we go for a discussion. നമ്മളിനി ഒരു ഡിസ്കഷന് പോകാം. ഇവിടെ ഞാൻ തന്നെ ഇരുന്നിട്ട് I'm not explaining this thing by myself. So, the Merin, as a student, she will be asking me doubts and her concerns, and I'll be clarifying it. Hope that's fine. Is that fine?
Yes, sir.
Okay.
So, first of all,
Okay.
sir, we are considering this as a known case. Okay. How we can consider this as a known case?
See,
sir?
this one is a non-case because it is given like it's a day clinic. First of all, we have to be careful about the setting. It's a day clinic. So possibly an admission and all is not possible in a clinic, right?
Yes.
Okay, ഒരു അഡ്മിഷൻ്റെ ഒക്കെ പോസിബിലിറ്റി ക്ലിനിക്കിൽ വളരെ കുറവാണ്. അതുപോലെ തന്നെ എന്താണ് പേഷ്യൻ്റെ ഹിസ്റ്ററി. The patient history has been given there and it's been, the doctor has diagnosed.
Yes.
Means the doctor has just diagnosed her as a post-traumatic epileptic patient. Okay, so the diagnosis as it's already been done. So now the patient is coming here to seek advices regarding her health conditions and complications.
Okay.
Health conditions, treatment, complications, she's very anxious. So based on that doctor's diagnosis. So just now the doctor has confirmed her diagnosis and she is here before us to get clarifications regarding her future management. So then we can make it sure that we can take it as a non-case.
Okay, sir.
Okay. So clear?
Yes, sir, it's clear.
ഡോക്ടറിൻ്റെ അടുത്തു നിന്ന് എന്താണ് ഡോക്ടർ ഡയഗ്നോസ് ചെയ്തു പേഷ്യൻ്റ് നമ്മുടെ അടുത്തേക്ക് വരുന്നു അങ്ങനെ വരുമ്പോഴെന്താണ് നമുക്ക് ക്ലിയർ ആയിട്ട് പറയാം ഇതൊരു നോൺ കേസ് ആയിട്ടുള്ളതാണ് പക്ഷേ എന്താണ് ഈവൻ യു ക്യാൻ ഗോ ഫോർ കൺഫേമിംഗ് ദ ഐഡൻറ്റിറ്റി കാരണം ഷീ ഈസ് ദെയർ ഫ്രം ദ ഡോക്ടേഴ്സ് റൂം ആൻഡ് ഇറ്റ്സ് എൻ ഒബ്ലിഗേഷൻ ഓഫ് എ നേഴ്സ് ടു ഇറ്റ്സ് എ ഡ്യൂട്ടി ഓഫ് എ നേഴ്സ് ടു ഗെറ്റ് ദ ഐഡൻറ്റിറ്റി കൺഫേംഡ് അതായത് ഡോക്ടറിൻ്റെ ഓഫീസിൽ നിന്ന് നമ്മളുടെ അടുത്തേക്ക് വരുവാണ് ദ പേഷ്യൻ്റ് ഈസ് ഹിയർ ആഫ്റ്റർ ദ ഡോക്ടേഴ്സ് കൺസൾട്ടേഷൻ ഷീ ഈസ് യു ക്യാൻ ഗോ ഫോർ കൺഫേമിംഗ് ദ ഐഡൻറ്റിറ്റി.
Sir, we have already asked the patient's name in 3 minutes preparation time.
Yes.
So again we want to ask for confirmation.
The thing is that we can start this role play in 2 means. There are 2 ways by which we can initiate the topic. One is like we are asking the name. Are you Mr. John? Okay, pleasure. Good morning, Mr. John. Hope you have finished your consultation. This is the usual way. You will be asking the name. The examiner will be giving you the name, and we are starting the thing. But there is another way. Like you just, good morning. Please come have your seat. I'm Abilash, the registered nurse. I hope you have finished your consultation with the doctor. Then the patient will be saying, yes, nurse. Yes. Could I have your health records?
Yes.
We are receiving the health records. Thank you. For my confirmation, can you please repeat me your name?
Yes.
From the case file, we are making the patient herself or himself to repeat their name. So this is a way by which we can go for confirming the identity.
Okay, sir.
Hope you are getting?
Yes, sir.
Hope you all are following.
Yes,
Okay.
yes.
So this is the another way. You can ask the patient's name. From the interlocutor can get a name, and you can go for confirming by repeating the name.
Yes.
And now here we are making the patient herself to repeat the name from the case record.
Yes, sir.
So this is the way by which we are confirming the identity.
Okay.
So these are the 2 ways by which we can go for an introduction.
Okay.
Fine?
Yes, sir.
Okay. Now we will discuss this task one by one,
Yes,
so that you can ask me the doubts. Even our students and aspirants will also learn.
Yes.
They will also understand how to deal each and every task. Fine.
Yes.
When it comes to second task, following the discussion, how can we start, Merin?
Actually, it is normal to start with.
Yes. So we got the name. The patient has informed us the name. Then we'll be going like, pleasure meeting you,
Yes.
Martha. Pleasure meeting you, Miss Martha. I think the doctor has explained you everything regarding your present health situation, isn't it?
Yes, nurse.
Okay, this is a way. Or has the doctor told you your diagnosis?
Yes, in that way also we can.
You can try another one sentence.
Yes.
Okay. Well, it is post-traumatic epilepsy. It is post-traumatic epilepsy.
Sir, do you think that it's a better way to say to the patients about his condition, about her
Yes,
condition?
it's because in this situation that is there, we have to discuss the condition with the patient. We have to make her aware.
Okay.
Okay, it's post-traumatic epilepsy. I have heard that you had an accident a year ago.
Okay, in that way also we can.
Yes, we are asking her. I have heard that you had an accident, also a head injury.
Yes, yes.
Well, okay, നമുക്ക് വേണമെങ്കിൽ ചോദിക്കാം.
Yes.
Okay, I have heard that you had an accident. Can you tell me how have you been feeling since the accident? Can you tell me how have you been feeling since the accident? Okay, so this is the way. Okay, I hope the doctor has the doctor told you your diagnosis?
Yes.
It's post-traumatic epilepsy. I have heard that you had an accident and suffered a head injury.
Okay, in that way we can.
Yes,
ask
this
to
is the way by
patient.
which we are going into details. Can you tell me how have you been feeling since the accident?
Yes.
So this is the way we are going into the topic. Okay,
Yes, sir.
fine. Clear, Anala?
Yes.
So hope you all are following. Then when it comes to third task, ask the patient's questions and reassure her of the safety of prescribed medication. See, the doctor has prescribed you medications.
Yes.
Okay, has he explained to you everything? How to continue that?
Yes. Sir, at that time I'm asking you about the safety of the medication.
Okay, so now the patient is asking about the safety. What we can do is we can assure the safety of these medications.
Okay.
Well, there is nothing to be overly concerned about. These medications are safe. Okay, they have been used in clinical practice for many years.
Yes.
Okay.
In that way, we can
Yes.
address that.
For this, in this present situation, it is usual to continue the medications for 4 years. Okay, it is usual to continue these medications for 4 years.
Actually, it's
Until there have been no
task.
seizures.
Yes.
Until there have been no
So,
seizures.
can we ask this question together, like this safety and the duration of taking this medication?
It's your choice. You can ask it together or you can separate the question. Okay. So for this, what we can answer the question, that answer that we can give, like what we can give is, yes, you don't have to worry about these medicines. There is nothing to be overly concerned about. These medications are in clinical practice for many years. Okay, and for you, it is usual to continue anti-epileptic medications for 4 years until there have been no seizures.
Yes.
Okay, probably it is a lifelong course. However, it is safe to use. Okay, you can continue it long term. Okay, it is safe for long term, for a long term use.
Okay.
Okay, you can continue these medications. Many people of your situation, same situation, are continuing this. Okay, they all are doing good, so there is nothing to be worried about. You can confidently start this medication. You can continue these medications with no worries.
Okay.
And there will be some slight side effects, but you don't have to worry about it. Clear? So this is the way by which we should convince the patient.
So the next task is discussing the headaches, blackouts, and how we can effectively controlled by this medication. And also, we want to explain about how to lead a normal lifestyle after taking this medication.
Yes.
So what all are the other points? I have already described you some points. I have already explained you some points.
Yes. I understand. See, in this,
But
tell
what
me.
all are the other points that we can tell to the patient to address his concern?
Can give you the answer for that. Okay, see, that question is, so the patient is asking about her further management. And there we can give a slight description of this epilepsy. We can go for a slight description of epilepsy. Epilepsy കുറിച്ച് ചെറുതായിട്ട് നമുക്കൊന്ന് define ചെയ്യാം. See,
Sir, is it mandatory to
no, it's not
explain about
mandatory,
it?
but to make the patient aware,
I'm
you can try
asking you
this.
because it is not given in the question.
It's not given, but in case, to motivate the patient, to make her aware regarding her health situation, it would be fine. If it is not there also, no problem. ഓക്കെ, അത് മൊത്തം പറയണമെന്നുള്ളതില്ല. നമുക്ക് എന്ത് ചെയ്യാം, ഈ സിറ്റുവേഷനെ കുറിച്ച് പേഷ്യൻറ്റിനെ ഒന്ന് ബോധറാക്കാൻ വേണ്ടിയിട്ട് അത്രയും പറയാം. സോ വാട്ട് വി ക്യാൻ ഡു ഇസ്, സി എപ്പിലെപ്സി, it's seen among people, it's an abnormal electrical activity of brain. Just give some simple explanation, never go for some different and difficult explanation, because he is a commoner, the patient is a commoner, she is a commoner, common folk. So you have to give the best suitable language where she can follow. So ഇപ്പോൾ മെറിൻ ചോദിച്ച ക്വസ്റ്റ്യൻ നമുക്ക് എന്താണ് കെയർഫുള്ളായിട്ടൊന്ന് അഡ്രസ്സ് ചെയ്യാം. വി ക്യാൻ ഗിവ് എ സ്ലൈറ്റ് ഡിസ്ക്രിപ്ഷൻ ഓഫ് എപ്പിലെപ്സി. ലൈക്ക് മാർത്ത, എപ്പിലെപ്സി ഇറ്റ് ഈസ് an abnormal electrical activity of brain. So this is a simple definition that we can give. Never go for some complicated explanations. Never go for that, because she's a commoner, a common folk. She cannot understand these complex words or languages, medical terms, and even OET is not appreciating that too. Okay, so we can give like Martha, this epilepsy, it is an abnormal electrical activity of brain. It is often associated with jerky contraction of muscles, loss of consciousness. So these are some simple explanations that we can give. There are some conditions that could trigger this, like sleep deprivation, okay, or overtiredness, social habits like alcohol, smoking. So try to get away from all these things. Okay, however you don't worry, if you follow these medications regularly, it will enable you to lead a better quality life. Okay, however you don't worry, if you follow these medications, follow the doctor's orders, taking a regular meals, okay, enjoying sleep for 8 hours, okay, avoiding overactivity and tiredness. If you do all this, definitely the risk of epilepsy can be avoided. The chances of recurrent seizures can be avoided. So these are the ways by which you can prevent the situation. Okay. So see, these medications definitely enable you to lead a better quality life. And if there is no seizure, okay, if there is no seizure for another 4 years, if they don't be having any seizure for another 4 years, we can go for stopping this medication. But before doing any such decisions, get a consultation done by the doctor.
Okay.
Okay. Okay. Until there have been no seizures. Okay. This medication will definitely enable you to lead a better quality life. See, until there have been no seizure for another 4 years, we can go for stop these medications. You can stop these medications, but before doing any of such before doing that, it is very essential to get a consultation done by the doctor. Okay, never go for self-diagnosis, never go for self-treatment. Just take the advice from the doctor and you can continue the treatment according to that. So this is the way by which you should make the patient convince.
Sir, how about the travel activity? So, do I can lead so you have already explained that I can lead a normal life.
You mean that second last task? The
Yes.
patient will be asking you doubts regarding her travel plans
Yes, sir.
and all?
Yes, sir.
Okay, she's
and
asking.
there are also some points that the second last task about
Okay.
the traveling plans.
Yes, yes.
There are many restrictions to take the medication to another country. If we take that medication, there are many restrictions. So, how we can explain those points, sir?
Of course, we can appreciate that concerns of the patient. That is
Yes.
definitely a question which could be valued. Okay, you
Yes.
have to appreciate that question. That is something very serious. Okay,
Yes.
in that there are certain restrictions for certain medications. Okay, in that task, how we can deal is like, well, so we are going into that dialogue. So how we can take this dialogue is like, Martha, yes, I appreciate your concern. I value your thoughts. I value your feels. Anything you can say. Okay, I understand why you're feeling this way. People of your situation feel the same way. See, for this medication, but for the best of my knowledge, I haven't got any information regarding travel ban. But there are certain restrictions for some medications. I can give you a website. Okay, I can put you in contact with certain supportive groups, or you can go through our website where we can find whether there is any restriction with the travel ban. But for the best of my knowledge, there is no such restrictions, but you can go through some websites. I can give you some websites, you can go through that will give you detailed information. Okay, so I think there is no travel ban or any restriction for cross-border conveyance or any transnational conveyance. You can definitely carry these medications along with you, but you can take a prescription. Okay, with the doctor's prescription.
Yes.
Okay, it is safe and effective for cross-border conveyance. You don't have to worry about it. Okay,
Yes.
but before going into travel activities, just get it confirmed from the sources. So I can give you websites and I can put you in contact with certain supporting groups.
Okay.
They will let you know more about this. So this is the way by which we should convince the patient. Okay?
Okay.
And so or safety instruction we can give a safety instruction like, and wherever you go, try to put a Medi alert bracelet or necklace.
Okay.
Okay. See, try to give this information too. Okay, and wherever you go, whenever you are organizing travel activities, try to wear an ID bracelet or a necklace. Okay, so that you can ensure a worry and woo-free trip. Clear?
Yes.
So hope you're okay.
Yes, sir.
Any more concerns or any more clarifications that
No,
you need?
sir.
And even there is something like a review.
Yes, sir.
Okay.
And no,
Hope-
before that, we want to give the literature about
Oh, okay.
epilepsy
So
and
I've just missed that.
supporting
Okay, and also we
services,
can give. And don't worry, I've got certain literatures. There are some brochures and booklets. Here are some brochures and booklets. You can go through this. It will give you more information on how to manage the situation. If you have a little knowledge, you'll be knowing how to manage, what to expect, what to do. So please keep this and go through this. It will definitely help you a lot. This will do a great help.
Okay.
Is that okay?
Yes.
So these are some good dialogues by which we can make the patient convince.
Okay, sir.
Okay. Any more discussion? Any more doubts?
No, sir.
Okay, and the last task is like a review. And so finally we are coming to the conclusion. The last task says that advise her to come back in 4 weeks time for a review. And see, the doctor has scheduled a follow-up visit after 4 weeks. Don't miss that. Please be here at correct time for review. Then only we will be able to assess your progress and can discuss further future management. So please don't miss that. Be here at correct time for review.
Okay,
So
sir.
that's it. The tasks all are finished.
Yes.
And the conclusion like, so do you have any more queries?
No.
We can ask the patient. Is there anything else that you would like to ask or discuss?
Yes.
We can ask like, the patient will be saying like, no, nurse, it was really fine talking to you. But So we are coming to the conclusion, how we can say like, thank you Ms. Martha, thank you for coming to see me. So wish you a better quality life. You can definitely enjoy your better quality life. See you after 4 weeks. See you for your review. Till then, take care. Bye. Finish. So everything is fine?
Yes, sir.
So shall we wind up the session?
Yes, sir.
So all of you, hope you all have enjoyed the session. Please go through this, make use of this. So this is an exam oriented session. You can go through this, make use of this dialogues, put your comments there in the comment box. So it will be, will be greatly indebted if you put your comments and your suggestions there. We can improve ourselves. Okay. We wish you a happy Easter and a very prosperous Vishu. Take care.
Thank you.